Okay, look at that. 2:01. Oh, hang on.
Everybody mute their computers if they're on. Are we good?
Yep. Is everybody good? Okay. We're going to try again. Hi there. Welcome to the, good God, what month is it? February. TCB meeting. I'm really glad to see everyone. You have just me today. My tri-chairs, this, as you all know, this is like a really busy time in session. And so my tri-chairs trusted me. Oh, please come sit near me, Kai, so I don't feel alone. I'm feeling very lonely up here. Yeah. So anyway, let's get started. Before we get started, I wanted to, I swear to God, you'd think that I would be prepared for these things, but I couldn't get into the internet. So now here I am. Okay. So I just want to give you a little update on where we are since we had our voting meeting. I believe it was January. And this is, we voted through recommendations for TCB. And, oh, sorry, I just have to take a deep breath. It has been a day, okay? So I've been running since I got up this morning and in and out of meetings. So I apologize if I'm very fractured. I'm not used to being up here by myself. If I feel fractured, I can turn to one of my co-chairs. And so this is the whole essence of mental health, right? Taking a minute, getting centered, taking a deep breath, something we want to teach everyone that we come in contact with, especially our children. So I'm just going to take a deep breath. Okay. So let's go back to the recommendations. We put in place House Bill 6951 in the Children's Committee, and we had a public hearing last week. The bill includes crisis continuum study recommendation, school-based health center study, and funding for mobile crisis recommendation. In addition, House Bill 6937 was referred to the Children's Committee and to the Human Services Committee. This bill would include the Medicaid rate recommendations, workforce stability recommendations, and school health service recommendation. So that bill is moving forward through Human Services. And please be on the lookout for any updates from Tau Youth Justice Initiative Institute on any information regarding public hearings, how to testify, or submitting written testimony. And lastly, we're awaiting updates on our recommendations regarding amending the age of ABA coverage for individuals with ASD. This bill will be referred to the Insurance Committee. So please look for any updates on that too on public hearings. In addition, I want to thank those of you who came forward and either waited out a very, very long public hearing that went to, gosh, I think that one was last week. I think it was 6 hours. No, was it? Yeah, it was the one that went to 8 o'clock, not the one that went to midnight. And thank you for providing testimony. Thank you for your staying to speak and testify. And Jeff, you get the award because you were in the room throughout it all. So we want to thank you for that. Anyway, so there we are. So with that, I am going to turn it over to Erica to take us forward.
Thank you. Good afternoon, everybody, and welcome to the Transforming Children's Behavioral Health Policy and Planning Committee. Erica Nowakowski, Executive Director for the Tau Youth Justice Institute, and we just have a couple administrative tasks to do first. The first one is to approve the meeting minutes of the January meeting. So can I please get a motion to approve the meeting for the meeting minutes for January's TCB meeting? Motion.
So moved.
Okay.
Seconded.
Second, thank you. Any adjustments, edits, revisions for the meeting minutes? Okay, okay, seeing none, can we get a vote, please? Approval? Okay, thank you, everybody. And I'm just going to do a very quick administrative updates for you all. The last time, it's been some time now actually, that we've talked about activating 2 new work groups. And those new work groups are the school-based work group. We still haven't come up with a total name of it, but it's the school-based as of right now, anything to do with behavioral health services in schools. There is a work group that we are getting ready to activate, and we have I appointed co-chairs for that particular work group, as well as we have the preventions work group. And we do have those chairs that have been appointed on Zoom, I believe. And so I'm going to first ask the prevention work group chairs if they can introduce themselves. I'm going to call on first on Ingrid and then Pamela after. Ingrid?
Hi, good afternoon, everybody. Like Cece, I had a bit of exasperation getting up here, but managed to do so. So, yeah, thank you. I'm excited to be co-chair of the prevention work group along with my colleague Pam. A bit of my background, I'm director of prevention at Liberation Programs, and I co-chair a local prevention council. And for many years, I was director of a regional action council. So my background is truly and my passion is prevention. So I was very excited for this opportunity. Thank you.
Thank you. And Pamela, are you on Zoom?
I am on Zoom. So, hi, everyone. It's a pleasure to be the co-chair and working again with Ingrid. A little bit of background about myself. I have over 25 years of experience in the prevention field. I'm truly passionate about it. Currently, I'm the director of the Alliance for Prevention and Wellness, which is one of the 5 regional behavioral health action organizations. We're a program of BH Care. And I'm also an adjunct professor in which I do a lot of work around prevention as well. So I'm excited to bring my expertise to work with the other community partners and with my co-chair to the group.
Thank you, Pamela. And now I'm going to call upon the school-based work group co-chairs, Dr. Elizabeth Connors, and then followed by Katrina.
Good afternoon, everybody. It's Elizabeth Connors. Thanks for the flexibility to join via Zoom today. I am a child clinical community psychologist by training. I'm an associate professor at the Consultation Center at Yale in New Haven, and I work with school systems throughout Connecticut, but also really throughout North America to implement quality improvement initiatives and other versions of evidence-based practice into education. And so I'm really excited to co-chair this new work group with my colleague, Katerina Vlahos, and we just can't wait to get started and gathering everybody and being good listeners and supporters and leaders of this work throughout the state. So over to you, Katerina.
Thank you, Dr. Connors. My name is Katerina Vlahos. I am excited to be here and co-chair this work group along with Dr. Connors. My commitment is really personal. I am an immigrant raised in the city of Bridgeport, have experienced a lot of adversity and trauma. I've seen firsthand the challenges faced by many in our diverse community. But I also recognize the privilege and the resilience that I had the privilege to have by supported individuals. For the past 15 years, I've worked alongside immigrant moms, their young children, I've worked with the Yale Gear Up program to advance education and career readiness for our youth in the city of Bridgeport that came along from the consultation center at Yale. Currently, I am the executive director of Bridgeport Prospers. It's an initiative within the United Way of Coastal and Western Connecticut. I lead initiatives to empower youth, children, and families to thrive. My role involves co-designing and co-developing along with community, ensuring that our programs promote racial equity, inclusive, equitable, and impactful, and through policy, be able to change systems and sustain them. I look forward to working with all of you in discovering and learning and listening. Thank you.
Thank you so much, and I appreciate getting the opportunity to meet with all four of you in the past 2 weeks and getting started. So thank you for your time, and we look forward to working with you. In your package, this is for the membership. In your package, there is and beyond the membership, but there is a QR code. If you are interested in joining any of these 2 work groups or any of the work groups, infrastructure and services, please feel free to scan the QR code and or you can contact Emily or myself and let us know. We will add you to the list once the work groups start meeting. But we do hope to have all the work groups start to meet in April. We needed a little bit of time with the session starting and identifying priorities, but we are getting to work again. And so we are looking for individuals to participate in these work groups. The other thing that I also wanted to bring to your attention, which we haven't talked about a lot here in the TCB, and that is about including the voices of individuals who are impacted by the policies that are made within these committees or recommendations, strategies, interventions, and so forth, the work that comes out of these committees. And so one of the things that, I hear sporadically from conversations with you all, conversations with our leadership of the committee is how do we ensure that we include the voices of those impacted by this work? And so one of the other areas of work that we are looking to activate at the TCB is a community voice work group. And that would be really working closely with organizations. We don't work with young people ourselves or parents ourselves, but really tapping to organizations in the community that do this work. And really helping. The last thing we would want to do, and I think anybody in this room would want to do, is to have it be sort of like a one-off type of, we call you, we need your feedback, and then that's it, right? But instead that this be true, authentic partnership between the membership and those impacted by policies and recommendations. And I do have some ideas of how to ensure that we work together and lifting up those voices. And so, stay tuned for more to come to that, because that's one of the things my team and I are really engaging in and connecting with some organizations. We already have 3 organizations that we've reached out to. Love 146, which you all probably are very familiar with, Favor, which it's another one that you're familiar with, as well as Full Circle. We are trying to engage as many diverse representation of our children, so, of children across the state. And so we will also be tapping into other geographical locations in Connecticut to do those contacts and connections and to invite them to this space and into this work. So stay tuned for more information to come there. Okay, and then on that note,
So now we'll be moving into the presentations for today. Our first presentation will be from Jamie Patton, who is a community voice, to talk about peer support programs in Connecticut.
Thank you. Thank you to the committee for inviting me here today. Thank you to the fellow presenters for sharing your platform with me. I'm genuinely very grateful for this opportunity to speak today. I won't lie, this is intimidating. There were a lot of acronyms I needed to Google before coming today, including TCB. I'm sorry, I had not heard of this committee. And I've been advocating in the world for mental health for over a decade now, yet there's still so much we all need to learn. Apologies. I'm going to begin with reading a couple messages I've received over the years. I know how consuming all this can feel, and always remember you are loving, intelligent, and loyal parents. Your kids see your devotion and strength. You are an incredible family. Your kids are so lucky to have you. My heart breaks for you, but I know you will all pull through. I really do understand what you are going through. It made me feel helpless and infuriated at the same time. Sending you so much love, strength, and patience. Hi, I was glad to see you at group last night and just wanted to say I hope you're having a good day. And lastly, keep your head up high. There is a lot on your plate. You are doing an amazing job as a mum. I hope you know that. That last line, I hope you know that, is such an empowering statement for me. I have never met this mother in person. We've known each other less than a year via Zoom, text messages, and phone calls. I do not know where she's from. I do not know where she grew up. I do not know if she has siblings. She probably thinks I'm English because of my accent. She doesn't know I was born in Manchester Memorial Hospital, 15 minutes from here, or that I've lived in America longer than I ever lived in England. What we do know about each other connects us so deeply that we can confidently send each other a text in a split second, providing strength, validation, connection, empathy, and most importantly, hope. These are the words I am lucky enough to hear or feel through friends like these. My name is Jamie. I'm a mother of 3 beautiful, exceptional, and unique children, and I currently use peer-to-peer support services in Connecticut. The support group I am here representing today is the National Alliance on Mental Illness Child and Adolescent Network, otherwise known as NAMI-CAN. While NAMI offer an array of mental health programs across the country, Connecticut so far is the only state where NAMI offers this NAMI-CAN group specifically aimed at caregivers and parents of adolescents with mental health conditions. And it was in a NAMI-CAN support group where I met the mother I spoke of just now. NAMI-CAN support groups are unique because they provide a safe, judgment-free, validating space where parents can take off their masks and just say what they need. I honestly don't have any other group of people I can do this with right now. NAMI-CAN is a support service, support being the operative word here. They do not replace other therapies or treatments. Most of us will be doing some combination of other services simultaneously. And if we are not, we are happy to provide each other with what we have found helpful in the past. NAMI's unique peer-to-peer groups are run by trained facilitators with lived experience. There's no clinicians moderating, no clinicians giving professional advice. Not to say there are not social workers, teachers, doctors, other field experts in the meetings, but not for those reasons. They are solely attending as parents. They do not bring their professional expertise to the table during these meetings. It is raw, vulnerable, selfless acts of showing up because we are doing everything we possibly can to help lessen our children's pain. We all bring our parenting expertise to the table, which on some days might feel like we have none. But in fact, at this point, we all deserve a PhD in parenting. The NAMI-CAN groups have empowered us to feel this, know this, and be able to tell each other this. As my friend texted me, I hope you know this. As far as I know, comparable programs are parent support groups provided when children are enrolled in services or a specific treatment program, such as an IOP, PHP, at an RTC, therapeutic schools. They will often provide a parent support group or a multi-family support group or both while enrolled in their services. While these are vital to attend and participate alongside our kids and show active engagement with the current program, it is still a different level of support. There is often a clinician moderating, and it feels temporary, meaning when the child leaves the program, so does the parent. And it can sometimes be hard to make real connections. In fact, they often do not encourage us to speak outside of group for confidentiality reasons. With regards to any difficulties joining a support group at NAMI, if you have access to the internet, you can join a group the same week somewhere. Through NAMI's Connecticut website, there's a calendar with all of Connecticut's meetings, listed, and those that are virtual have the Zoom IDs and passwords right there, so you don't even need to talk to anyone first. No evaluations, no assessments, no intakes, no forms, no PPTs, no wait lists, no waiting rooms, no police escorts, no ambulances, no insurance referrals, and no cost. Just other parents waiting to validate you, provide strength, hope, empathy, and connection. For those of us that have endured the list of frustrating processes I just mentioned, NAMI Can is a confidential space to take off those masks and provide that intermediate bridge of strength we as parents need while we wait for the next steps, to hear what the next plan is, to work out the next level of treatment. We are our children's first responders, so anything we can learn while we have to wait is worth it. We provide an environment in meetings to practice listening and validating. Often this is what our kids need the most. They need to be heard and not to be fixed. The more practice we can do this with other parent peers, the better we can show up for our kids. Unfortunately, we tend to wait and look for services while we're in crisis. Do not underestimate the healing for yourself and ourselves by helping others, sharing your story when there is calm. My groups and facilitators have inspired me, and this April I will be taking my NAMI training to facilitate a local NAMI Can class. The hardest part of joining a new group is exactly that. It is a new group. Second guessing if we are eligible to join, the fear of being vulnerable, exposed, and removing that mask. If I'm asking my child to be vulnerable and seek support services, why can't I as well? Putting myself in their shoes is the least I can do. If you are a parent and you've ever felt isolated or helpless, lonely, possibly felt some shame or guilt, or doubting your success as a parent, you qualify. Everyone is welcome. We all need more empathy in this world. My peers and I are all on the same roller coaster, and it is frightening because it is so very unpredictable. We do not remember buying tickets for this ride, yet here we are buckled up tight. None of us know when that next loop-de-loop is coming, but it is. What I have learned is that it all takes time. Everything needs time. This is a never-ending journey, but with enough support, we can all stay on track. And suddenly those loop-de-loops do not get any smaller, but become much less scary. Then over more time, they might begin to feel more like a Ferris wheel. This support we receive from each other then funnels directly back to our children. My peer-to-peer groups are my self-care. I always cringed at the term self-care. Here I am with crisis barging through my door, uninvited, the pressure boiler is exploding in my hands, and I have professionals telling me to make sure I make time for myself. My house is on fire, and I do not want a bubble bath right now. And then I remember the oxygen mask. Always put on your own oxygen mask before assisting others. While I understand the concept, it goes against my mother gut reaction. Since the day I became a mother, it has always been my auto response to take care of the kids before myself. I struggle with this to this day. Previously, I was trying to get on the Ferris wheel with looking for my self-care, but my ticket was for Space Mountain. It took me a long time to understand this and recognize I was already filling my self-care bucket without knowing it. My peer-to-peer support groups are my oxygen mask. I joined peer-to-peer to help myself help my children. I can only help if I have enough oxygen. It does not happen quickly in the world of mental health. All the long-term healing and sustainable healing takes time. We all definitely need our own oxygen masks if we're going to make it through. In fact, I was unsure last night if I could come today as I currently have a child in the ER. I was lucky enough to join a support group this morning, exhausted to the bone and battling with what to do. Together, they held my oxygen mask in place and reminded me what we are all doing. The best we can with what we have. My kids are safe. I have time. And so I could come. The same peer group I joined this morning, we always start and end by reading NAMI's 12 Principles of Support. We each take turns reading one line at a time aloud, and it is very grounding. If we had more time, I would ask that we would do this exercise together, but instead I'll ask that they be placed on the screen for you to read yourselves, please. I did not come today to tell you my story, my journey, or the fear.
I'm gonna wait. I have one quick question for you. The Connecticut Gun Violence, the coalition.
Commissioner, can you please
Commission?
introduce yourself?
The coalition. Coalition.
I did not come today to tell you my story, my journey, or the fear of what is yet to come. This will come later, and it won't be me sitting here. It'll be my kids, my beautiful, exceptional, unique children. They will be up here on their own platform one day, telling their stories, providing their journeys of hope, and advocating for themselves, their peers, and the generations to come. What can I do today? I can continue to show up in any way I can. I find strength and hope and provide validation and empathy, and will forever be grateful for the connections I have made. Thank you.
Thank you so much for being here, and thank you for sharing your story, and also for being here when you've spent the night with your children in the hospital. We really appreciate you, and we appreciate everything that you shared.
Thank you. And we are now going to move forward with the peer-to-peer, learning more about peer-to-peer models, not only nationally, but also here in Connecticut, as we have some very good programs here. First, I want to invite Millie Sweeney, Director of Learning and Workforce Development. Are you online, Minnie? Millie?
Yes, I'm on Zoom.
Thank you. Please introduce yourself and you can begin the presentation.
Sure. Let's see if I can share. Right. Thank you. Good afternoon, and thank you, Jamie, for grounding us in why we talk about these type of services. It really is to support and partner with youth and families for the best outcomes. So I very much appreciate getting to hear you from one parent to another. I understand the ride. So good afternoon. Thank you for inviting me to share a national perspective on parent peer support, which is what Jamie just beautifully exhibited and described for us, and the lived experience workforce. My name is Millie Sweeney, and I'm the Director of Learning and Workforce Development for the family-run Executive Director Leadership Association, or FREDLA. I'm trained as a clinician, but my children brought me into the peer support arena as both of my youth struggle with emotional and behavioral challenges. The majority of my career is focused on developing collaborative systems of care in partnership with youth and families and the professionals that support them. Just briefly, if you've not heard of FREDLA, we provide support, consultation, and training to advance positive outcomes for children, youth, and families. We focus on capacity building, on developing and delivering specialized tools and curricula, facilitating solutions, informing policy and practice, and performing implementation readiness. Our work lies within and among five primary areas that often intersect with one another: strategic solutions, workforce readiness, which is what I'm here for today, research and outcomes, and training and resources, and family-run organizations. We are the only national association of family-run organizations that's dedicated solely to all children, youth, and young adults with social, emotional, substance use, and multi-system challenges. We all are parents ourselves in our organization. And in our work with organizations, with states, and with national partners, our role is to reflect the collective experience of family organizations across the country and elevate the importance of family engagement to support family partnership and system transformation. The relationship that families have with providers and others from child serving systems is very important to them. In fact, for families, that relationship itself is an outcome that they prioritize when they engage in services. Last year, FREDLA in collaboration with the University of Texas Arlington, the University of North Carolina Chapel Hill, and 6 family-run organizations in diverse parts of the nation, completed a research project that was funded by PCORI, which is the Patient-Centered Outcomes Institute, where we, using 2 rounds of focus groups, ask youth and families which outcomes matter most to them when they seek services. And the graphic that you see here highlights those top outcomes for parents and caregivers, that's in the teal circle, and for youth in the red circle. Where they had common priorities, those are listed in the middle where those circles intersect. What's interesting is that families consider the experience of accessing and receiving services as an important outcome for them. In this study, caregivers prioritized service quality outcomes primarily. They expressed a desire for an accessible, respectful, and supportive treatment environment underpinned by well-trained and culturally responsive professionals. Caregivers also desire seamless cross-sector provider collaboration and ease of care transitions, which integrate the insights and the preferences of families and children themselves, crafting a customized, individualized care plan. Youth expressed a desire to be truly heard, to have their ideas and goals acknowledged and valued, to be allowed to make mistakes and learn from those, and to engage in positive interactions with providers. Now, this partnership with families occurs on a continuum that differs in intensity and authenticity, from family involvement to family engagement, and then to family-driven, which is full partnership. Family involvement occurs at that individual family level. Families are an important and essential source of information in developing goals and approaches. They know the needs of their child. They understand the effectiveness of past services because they've lived it, and the supports they need to be involved. From a family perspective, this may include activities like family input into the initial and ongoing assessment, evaluation, and treatment planning processes, or participating in family therapy, being part of parent support groups, as Jamie spoke about, and families defining the goals for intervention. Family engagement builds on family involvement to incorporate family experience and expertise at the programmatic level. That means they offer perspective in program design, delivery, and evaluation that helps programs become more effective. Now, family-driven care, which is full family partnership, refers to full integration and support of family perspective and partnership approaches at that high organizational level. And that means that there's family representation in executive groups, in paid positions within the program, and in operational functions, including hiring decisions, organizational development, and any type of continuous quality improvement process. These partnership activities are the responsibility of everyone involved in working with and supporting families. So while there may be someone who leads these type of activities in an organization or in a group, it's incumbent upon every one of us to engage families and to use that partnership approach, regardless of what our role is. And it's not just families that say engagement and partnership is important. During the past 30 or more years, top researchers in the field of children's mental health have conducted studies showing the positive outcomes that result from engaging families. Their studies are across systems, settings, and interventions, and this is what they've learned. Engaging and partnering with families yields positive outcomes for children and youth, their families, agencies, communities, child serving systems, and even managed care. There are even specific highlights that are focused on outcomes for kids and families when dads are involved, when dads are engaged. Fathers are so important, but they're often not intentionally engaged. And in our professions, we really need to do better in this area. You have this full graphic and some of the additional resources and materials that were shared. So you can see there's a lot of value in partnering with families. It changes institutional culture and practice from leadership to types of services offered. It builds awareness and understanding of family situations, as well as builds self-efficacy for parents and a sense of community. New practices and effective policies evolve from fully engaging families at all levels. It not only improves individual child and family outcomes, but also the entire organization's outcomes, meaning that staff and mission are positively impacted as well. Family partnership informs the realignment of resources, which are often scarce, to services that families identify as helpful and needed. And so their participation and their leadership in research and evaluation helps in interpreting and maximizing the use of data and resources. Engaging those families in policy work, as I heard Erica talk about having a committee about this, yields policies and processes that positively impact families and communities, and avoids often unintended consequences of policies that are developed in a vacuum without their input. The most effective way to engage families is parent-peer support. There are direct activities that parent-peer support providers and family-run organizations, of which there are several in Connecticut, that they do and functions that they fill that can lead to those important family engagement outcomes across all those settings. This is another part of the resources that you have that list the types of things that parent-peer support providers do to reach those outcomes that we all really are looking for. Parent-peer support, which also goes by the name family peer support, family support partners. There's a different name in every state for how they're referred to, but it grew out of the family movement, beginning in the 80s with CASP, which was the Children and Adolescent Social Services Program, through the development of statewide family networks and national organizations focusing on families and family-run organizations, to a bulletin in 2013 from SAMHSA and from the Center for Medicaid Services stating that peer support works and family-driven care is something that we should be doing, encouraging states to use their Medicaid dollars to fund such services. It's a growing service that fulfills a variety of roles, facilitates effective service connection and collaboration, and promotes partnership between providers and those they serve. The peer workforce has been steadily growing in response to gaps in access. There's a shortage of mental health professionals, so they can support families while they're on waiting lists. There are geographic challenges that affect treatment options and access. There are concerns over treatment compliance and participation. The parent-peer support provider can help that family and help that provider to understand what is keeping that engagement from happening. It also helps with recidivism that's associated with strictly traditional approaches, and it builds in family voice and choice and skill building. It's not a clinical service, but it is complementary to every other service that a family can receive. And it really enhances the work of both the family and everyone else that's working with them. Parent-peer support providers are experts in this field. Their lived experience is expertise. It has value, and it is a true asset in children's mental health for all of the reasons that you see here. They have lived this 24/7. They have had to navigate systems and learn how to work through policies and procedures that don't fit together across systems. They are consumers of the services of the system, so they have a customer's view that's very valuable to administrators. They need that feedback for continued funding, program improvement, developing new practices. And last but not least, they have a passion to make a change. This is not just a job for them. It becomes almost their identity. They tend to be more consistent and persistent to make things better for families and youth. And they really act as cultural brokers and translators between youth and families and providers. Now, although parent peer support is provided in some way in every state, there are multiple models, trainings, and certifications that are available. There are core competencies that can be found across states and programs. The role of the parent peer support provider may be defined in various ways, depending upon the state and funding entities. They may also fill a variety of positions across settings in the spectrum of children's mental health services. Essentially, though, these are the standard activities that are performed by parent peer support providers. They connect with families, they support them in many ways, including reducing isolation that Jamie spoke about. They help them navigate complicated systems. They also do training, including evidence-based curriculum that help families to better understand how to support their children, how to navigate systems. They engage in policy making, they provide education, they even collect data. They make amazing data collectors and evaluators, providing that family perspective and really engaging with those that they're gathering information from. And of course, they're advocates. They're speaking up and being solution focused on things that matter most to children and families. There are roles that they can fill across the range of service intensity levels that enhance family engagement outcomes. Again, it's not a clinical one that's based on a degree in clinical training. Their role and their work with families is based on their own journey through systems and through the training that they get. There's lots of ways to infuse parent peer support in different systems and through all kinds of funding mechanisms. Just a few examples. In the education system, Title I schools are required to have a parent involvement plan, and parent peer support could be part of developing and implementing that plan. They can also provide training for parents and school staff, special education support, and transition support between schools and preparing for after high school. We're familiar with how they work in mental health, and it's usually funded by block grants, contracts, funds for mobile response and stabilization services, and Medicaid. Parent peer support providers are on wraparound teams. They provide individual and group support. They're in part of intensive in-home therapeutic service programs and even embedded now in emergency departments, residential care, and hospitals. In juvenile justice, there's funding through the Office of Juvenile Justice and Delinquency Prevention. When I was with the family-run organization in my home state, I had a family support provider program in courts that was very effective and helped with recidivism. They also can provide training and support for parents who may be incarcerated. And so they're also part of the criminal justice system, getting them ready when they come out to be effective in their parenting role. There's funding in child welfare to prevent custody, to stabilize placement, and to reunify or facilitate permanency. And then also in pediatrics and in disability services, the list goes on and on. They pretty much fit everywhere. Anywhere that families are is where they can work. There are challenges, and for every challenge, I would say that there's also solutions. Some of the challenges that you see here is for the parent peer support provider themselves. Personal challenges may come up. There is the potential for this work to be triggering when you're faced with families with similar situations, and they may still be dealing with the needs of their own child or youth that could impact employment at times. And many workplaces don't have policies that fit this lived and living experience. They may also have been out of the workforce for a long time due to caregiving for a child with complex needs. When they're hired in clinical settings, they may be the only parent peer support provider there, or they may be with an employer who doesn't quite understand what they do. They end up being challenged in maintaining their identity as a peer in those type of settings. And unfortunately, parents still face stigma. There's still a view that they're the cause of problems when really they're part of the solution for our children. Organizationally, a lot of organizations aren't ready for this type of workforce. The compensation is inadequate, and there's usually not a career ladder. Supervisors, they often get put under clinical supervision, but they perform a non-clinical service. So that's confusing on both sides. There's misunderstanding about the role. And then, of course, consistent funding is always an issue that needs to be diversified. What we need is people that fund what they value instead of just going along with what you normally do. Systemically, reimbursement rates are low. And we see from federally on down a lumping of all types of peer support when they're very different. Adult peer support is not the same thing as parent peer support, which is not the same thing as youth peer support. There's a lack of understanding of the role, and hiring practices often can be barriers for those that are going into this workforce. Now, all of these barriers presented as challenges can be overcome and addressed by process, by training and support. And the benefits, as you heard from Jamie, far outweigh the challenges. There are solutions for all of these. This includes establishing quality standards for this work that fits each type of peer support and focuses on competencies. This should encompass standards for employers as well, requiring training for supervisors specific to peer support, incorporating family perspective in reviewing and revising policies and procedures to better fit employees that are hired for that living experience, and establishing wages and reimbursement rates that provide not only a living wage, I would say a thriving wage, but also career advancement opportunities. It's key to develop accurate job descriptions and discuss how parent peer support work is integrated into an organization and how they're going to work and collaborate with other staff and other roles. Cross-training is another great strategy to use. Parent peer support providers thrive with ongoing professional development, a supportive and therefore productive workplace environment, and connection with their peers. So communities of practice is a great way to accomplish many of these things and offer that ongoing learning and leadership opportunity. Challenging stigma. I'm sorry. Somehow I stopped sharing. I don't know how that happened.
Stop sharing for you, sorry, so we can see your.
Oh, okay. There we go. So challenging stigma was the last thing I was going to say. Making sure that when you run across misinformation and when you run across myths, they're challenged right then and there with facts and with data. And with that, thank you.
Thank you. And we're going to reserve the questions till the end of all the presentations, just to allow for all the presenters to do their presentations. Next up, I'd like to invite Elise Kelly from the Child Health Development Institute.
Thank you. Thank you, Quinn. Sorry. I'm presenting today on behalf of both CHDI as well as the Children's Behavioral Health Plan Implementation Advisory Board, and this project is funded by the Department of Children and Families. I'm presenting on a current project that we are working on to develop a report with recommendations and an associated action plan regarding expanding family and youth peer support specialists within children's behavioral health services in Connecticut. Next slide. Just a little background on the project. This really grew out of a strategic plan for the children's behavioral health workforce that we published in November of 2023. That strategic plan really reflected extensive work to identify best practices and innovative solutions to address the workforce shortages in Connecticut. And one of those recommendations was to expand the youth and family peer support specialist workforce. This topic was subsequently approved by members of the Children's Behavioral Health Plan Implementation Advisory Board as a priority for this year, which helped us launch this project with funding, again, by DCF. This project is going to build upon existing work completed within Connecticut. It's really important to us that we don't reinvent the wheel, and there's a lot of great work that has been done, including a family peer support manual that was completed several years ago by Favor and Fredla, as well as DCF and others. And we're also benefiting from complementary technical assistance from SPARK, which is the SAMHSA program to advance recovery knowledge. And we're specifically lucky to work with Millie Sweeney, who you just heard from. Millie is part of a project steering committee that's guiding this work, and other members of that steering committee include representatives from DEMIS Young Adult Services, DCF, Favor, AFCAMP, Children's Behavioral Health Providers, family members, peer support specialists, and others. Next slide. The goal of the project is to develop recommendations for Connecticut to expand the family and youth peer support roles within the children's behavioral health workforce. And our timeline is to finalize the report end of September of this year. Just a couple of notes related to this. In terms of behavioral health, we are including both mental health and substance use as we look at services. And we are looking at both family peer support specialists and youth peer support specialists, which, Millie explained are really two different roles. The family peer support specialist being someone with lived expertise as a parent or caregiver of a child who has had behavioral health needs and treatment and is now working with other family members. And then on the youth side, that would be an older teen or a young adult whose lived expertise is related to their own personal experience with behavioral health needs and treatment and now working with other children or youth. Next slide. Just a quick review of the broad questions that will be addressed through this report, through this work. First, we just want to really clarify the role of family and of youth peer support specialists and clarify that from other paraprofessionals who are also critical to children's behavioral health services. We're looking broadly at best practices in a variety of areas related to these roles within the literature, but also through a scan of other states, of implementation in other states. We're looking at the current landscape within Connecticut, both for family and youth peer support, but also learning from what has occurred with adult peer support as well. Looking at how we can integrate, effectively integrate with the existing children's behavioral health workforce. And then, we want to look at, there's, of course, well-documented, as you've already heard, value of the lived expertise in and of itself that is of great value. And we also want to look at how youth and family peer support specialists can address additional systemic challenges that are occurring within the workforce, such as shortages, a lack of access, or a need for more access and higher engagement with youth. And then the report will include a set of recommendations regarding what the state can do to support the expansion of family and youth peer support specialists. And next slide. Those recommendations will address the topics that you see here, including training and certification, the roles and scope of practice, supervision models, career pathways, integration, readiness of both the system and services and programs, expanding diversity, insurance reimbursement, the roles of a variety of partners, and then really looking beyond family and youth peer support. How can we expand the role of lived expertise across the system? Next slide. I just want to emphasize one area that's really underpins the other recommendation areas and is most relevant at a policy level, that looking at insurance reimbursement and other funding strategies will really be critical as we look at implementation and sustainability of any family or youth peer support roles in the system. Next slide. just a quick review of the methods for this project. We have completed a literature review and landscape analysis. We're now working on key informant interviews, which will include both local experts as well as out-of-state expertise from out of state. We're conducting focus groups, both with providers and family members, and surveying peer support specialists, other paraprofessional roles, and youth as well. Next slide. We've been looking at the landscape of peer support within Connecticut, both family peer support programs and youth peer support programs, the variety of training and certification programs already in existence, both within broadly in behavioral health as well as within recovery programs where there's typically a little longer history of those services. And really a kind of a variety of programs, both within behavioral health services, but also as it touches other systems that youth and families are involved in. And finally, last slide. Finally, just a quick review of our next steps. We are engaged in scheduling interviews and focus groups, and we'll very soon be distributing a survey. We anticipate that a draft report will come out in July of this year and the final report in September. Thank you again for the opportunity to present today.
Thank you, Elise. The last presenter will be Quinn. Oh, Favor, sorry, we have one more. Favor will be presenting. Sorry.
Yes, we're here.
Okay.
Thank you.
Jenny.
Good afternoon, TCB members and community. My name is Jenny Bridges. I'm the executive director at Favor. I am a mother to 5 children and a grandmother to 2 children. I was called to this work 17 years ago when my child was experiencing significant issues at school. And with me, I have.
Hi, I'm Carol Westerholm, the Director of Peer Support Services at Favor. I've been here 20 years. I can't believe it. And why I came was I have 3 lovely boys. The middle one gave me a lot of challenges, but a lot of joy. And when I finally kind of figured out, now you never figure out exactly what you need to do, but when I kind of felt comfortable with it, people started calling me, and then I decided, you know what, this is what I want to do, sit alongside another parent, helping them navigate the systems. Thank you for having me.
Yeah, so thank you, Emily. If you could put the slides back up. To talk to you, give you a little overview about Favor. So next slide, Emily. We're gonna be talking about, our background, our philosophy, our mission, our Favor programs, and then we're gonna go into depth about our family peer support specialist services, and we're going to be reviewing some outcome data. Next slide, Emily. So a little bit about Favor. We were incorporated in 2002. We are a statewide family-led nonprofit organization committed to empowering families and partners in improving educational and health outcomes for children. Favor is a Connecticut state affiliate organization of the National Federation of Families for Children's Mental Health. Next slide, Emily. Our mission is to empower families so that they can effectively advocate on behalf of their children and access family-driven and culturally sensitive services that improve their child's outcomes and their family's well-being. We offer a single place for families with children who have mental, behavioral, or special healthcare challenges to find information, assistance, and training. Our philosophy exemplifies our key core values, which is family empowerment, mutual respect, accountability, and partnership. Next slide. Here's an at a glance of the 4 Favor programs, and we are going to be talking more in depth about the peer support program, but I did want to highlight the other three. So our Family Systems Manager program, our FSMs build coalitions connecting multiple sectors of the community to drive collaboration and develop plans and policies to implement strategies that support prevention efforts. Our FSMs collaborate with the Department of Children and Family System program directors to analyze system needs, monitor system functioning in order to promote and sustain system improvements across each of the regions of Connecticut. And our collaboration brings community partners together to share experiences, problem solve, and develop innovative approaches to family engagement. Our medical home program has two parts. We have extended service fundings, which help families that are underinsured or uninsured with children who have special healthcare needs who do not qualify for Husky insurance. We also have the respite part of that program, which helps families qualify to receive respite funding. Our Learning and Leadership Academy is a learning collaborative, and we provide virtual and in-person trainings. And it is designed to guide and mentor family and young adult champions interested in developing leadership and peer support skills. Through these trainings, young adults and families receive ongoing development around family advocacy, support group facilitation, sharing their story, and more. Through the LLA, we are establishing the infrastructure to help parents, caregivers, youth, and young adults pursue national certification through the Federation of Families of Children, while also strengthening the workforce capacity of the family and young adult peer roles through our peer internship program. Next slide, Emily. Our Family Peer Support Program provides the direct peer services to families who have children with neurobiological, mental, emotional, or behavioral health challenges, also for children who are medically complex, and also for children who have special education needs. We provide a safe space for parents to share their experiences and their challenges. We also provide expertise in educational needs, and we understand the parents' needs. Next slide.
Hi, I'm going to go over the profile of a family peer support specialist at Favor. Of course, we come with that lived experience. We are all parents and caregivers of children with some type of mental health challenges. Our peers receive ongoing training. They first come in, they meet with Human Resources, they meet with me for a couple of days to hear about what the role is really of a family peer support specialist at Favor. We review paperwork and how paperwork is to be submitted. The next few weeks, they will shadow other seasoned peer specialists. It's good to get a variety of the way people do this. When ready, I will assist them in opening their own families. We are also members of COPA, the Council of Parents, Advocates, and Attorneys. So each year we send a few of the new peers to the conference and then obtain the web trainings that were presented. The peers will view these while in training, and any other staff can access them when they have time. At our biweekly team meetings, we have attorneys, special ed advocates, other providers to present to us so we can learn more. We are nationally certified as Family Peer Support Specialists. So what we do is we'll meet with the family to hear their story, share their concerns and their struggles. The Family Peer Support Program is not a case management service. We work in partnership with the family in order to ensure they receive high-quality services. Family Peer Supports promise to maintain regular contact with their family, assist and support the family at any school meetings or any meetings they would like, help the family identify the appropriate services needed. We support the family to make sure that their voice is heard and that they are an integral part of their child's educational plan at every decision-making level. We assist and support in collaboration with other service providers. We help identify resources, strategies, and services needed. We show the parent how to read their school reports, such as tests, assessments, evaluations, IEPs. We provide information on understanding their child's diagnosis. We help identify the child's strengths, support in identifying the child's needs. And basically, our goal is to empower the parents by giving them the knowledge and confidence needed so they can continue advocating on their own for their own children. Next slide, please. Oh. So Favor Family Peer Support Program is a free service. We are mostly funded by DCF. We have 12 peer supports across the state. Referrals come from parents, caregivers themselves, providers, schools, hospitals, DCF who's discharging families refer to us, and also other community providers.
You can stay on this slide, Emily, just for a minute. Go ahead, Carolyn.
Okay, so this just shows how we are all across the state. Our peer supports live in or close to the area they cover. And this is because they know and may have used the resources in the area to help the families they serve. We have a triage coordinator, Lynette Cruz, who handles and calls every single brief referral that comes into the office. And she does that to gather more information, deem if they're eligible for our services, before sending it to the peer support specialist in that area. Next slide, please. We receive referrals in two ways. We get referrals from the system of care. The care coordinator will send a referral to us if the family has educational needs or if the family is very complex. We will work with them as a team for the family for about 6 months. Most of our referrals come in as brief interventions, as we call it. We work with these families for about 3 months, and again, the referrals come from a variety of ways. If the family has many needs, we'll refer them to care coordination and work as a team. So there's 2 ways you can refer to us. You can, referral forms can be submitted via email at refer@favor-ct.org, or we have an online referral and the link is provided there below. Next slide, please. So some outcomes from last fiscal year, FY24. So we received a total number of referrals, 1,319. So with that and 12 peers, you can see that there's a lot of people on a wait list. So how we handle our wait list is that every peer provides the family consultation prior to intake. The peers last fiscal year spent 1,308 hours consulting with families. Some families, while sitting on a wait list, will receive enough guidance that they can be discharged as completed treatment goals without even going to intake. We served 542 families in total last year. That was 331 unique families, 146 families that received consultation and never went to intake as completed treatment goals, and 65 siblings. The other graph shows the school services or increase in school services the peer specialists were able to obtain for the children and youth. The data has been consistent over the past few years, showing the greatest increases in services in both academic support and counseling. There was a 43% increase in academic support from intake to discharge, and a 36% increase in counseling service, again from intake to discharge. The peer support specialists are helping students who are dealing with anxiety, other mental health issues, school avoidance, and a regression in academics, still feeling the effects from the pandemic. The increase in service, especially in academic and counseling, has proven to achieve better school outcomes. Children and youth spend most of their time in school. It is important that they become and feel more successful and confident. Uncovering learning disabilities along with counseling service needs can eliminate or lessen behaviors. Also, in the last fiscal year, the peer support specialists were able to secure 44 therapeutic day placements, and those are for children who could not be educated or maintained in the traditional public school setting.
Next slide. So on this slide, for more information, if you needed to contact us about our peer support program, you can contact Carolyn directly. This is her contact information. Our team is doing incredible work supporting families. However, as you can see, some of the families were not directly served due to our wait list, underscoring the urgent need to expand the need of peer support specialists across the state. While we all recognize the invaluable role of peers, our services have typically not received the same level of recognition as clinical services, but change is happening. This moment in time continues to validate the essential work we do alongside parents, caregivers, youth, young adults, and provider partners. We invite further discussion to strengthen funding for peer programs statewide because we all benefit from peer support. Thank you for your time and attention.
Thank you.
Thank you so much, representation from Favor. Now we're going to hear from, you've been hearing about the parent family support models. Now you'll hear regarding the youth peer support models. Quinn?
Good afternoon, everyone. Thank you so much for taking the time to hear me out. I appreciate y'all being here. My name is Quinn Giannetti, and I am the project manager and a certified recovery support specialist here in the state of Connecticut for a project called the CT Support Group. Our project is housed at Positive Directions in Westport. Next slide, please. The CT Support Group is an online platform that is funded by the state that provides connection, peer support, and community for teens and young adults across the state of Connecticut. Our goal is to provide an inclusive, trauma-informed space that prioritizes consent, choice, and mutual respect for young people to share their experiences and to build a supportive community. To date, our website has reached over 385,000 users who are looking for resources and support. Since the project added a peer support specialist to our staff, we have supported an average of 15 young adults annually, many of them dealing with isolation and disconnection. This is with one staff member providing peer support as one part of their job, with the other part of their job being managing the project as a whole. We launched a Discord server last month, and we have already gained over 40 teen and young adult members looking for peer support. Next slide, please. Our focus is on connection, peer support, and community. So I want to use this as a through line as I continue to speak to you about what we do. Connection happens through our website and our Discord server. Discord is an online platform that is popular among young people that allows users to connect via text, via voice chat, or via video. Our server has multiple channels spanning a variety of topics that folks can jump into at any time. Those topics include humor, creative expressions, spot for resources sharing, and of course, direct peer support. Our website hosts blog posts from young people sharing their experiences with mental health and wellness, their personal stories. We have a service map locator and other resources by topic. We offer free voluntary direct peer support with no referral needed to any teen or young adult throughout Connecticut through our Discord server 4 nights a week. In addition, young folks can request a one-on-one meeting with me to get peer support outside of those Discord hours. We also connect young people to other peer support offerings throughout the state, including Join Rise B's Young Adult Warm Line, which fielded over 1,160 calls last fiscal year. We also connect folks to the NAMI Young Adult Connection groups and events, Gloria House Peer Respite and Warm Line, Advocacy Unlimited's Bridger program, New Haven Pride Center's peer mentorship program and youth offerings, and more. Our platform acts as a clearinghouse for peer supporters and peer support offerings throughout the state. Unfortunately, many of these offerings are unavailable to folks who are under 18. And this informed our decision to launch our Discord server and make it available for teens as well as young adults. Lastly, our project centers community. Our goal is to continue to grow our Discord server and to cultivate a virtual space where folks can build community and combat those feelings of isolation and disconnection and fear of not belonging. Next slide, please. Peer support is central to our offerings. It is rooted in shared lived experience, and it allows us to connect with one another. I think it's really important for folks to understand what peer support is, what it isn't, and why it's important. Peer support is collaborative and mutual. Participants and I are constantly learning and growing alongside each other. That means that both the peer supporter and the participant are actively engaged in building trust and deciding what that looks like together. The first thing that I tell any participant that I meet with when I have a young person in front of me is, I don't expect you to trust me off the bat, and I don't want you to trust me off the bat. I want to earn your trust, and I want us to decide together what that looks like. Peer support is rooted in curiosity, consent, and choice, not fear. This is critical for understanding what peer support is. As a peer supporter, I am curious about what my participants are experiencing and feeling. I'm not there to give advice or to tell someone what they should or shouldn't do, but rather understand what their needs are, and then we work together to find ways to meet those needs. I don't operate from a place of fear of what might happen or what someone might do, because that often leads to exertion of control. Peer support participants should always be able to consent to conversational topics, to answering questions from people, to hearing about resources that may be relevant, but they should never be forced to do any of those things. That disrupts the collaborative nature of this relationship, and it also disrupts the trust and rapport that we aim to build with each other. Peer support is non-hierarchical. Non-hierarchical peer support relationships are not devoid of power imbalances, but rather they center the relationship as a space where both people can learn and grow together, and not a relationship in which one person is an expert or knows more, or is more healed or recovered or more worthy than the other. We understand that we are all the experts of our own experiences, and we treat each other as such. Inviting curiosity into peer support relationships and conversations allows us to get information about how we each view the world and how we came to know what we know about the world and the ways that we operate in it. Curiosity invites those conversations to learn about each other and to share those experiences and to find those points of connection. We can learn what feels generative and connecting. We can learn what leads to disconnect. And so we can operate in our relationship and try to avoid those things and work through them together as they arise. Participants define their own goals, and peer supporters are here to walk with folks on their journey towards achieving those goals. Next slide, please. This is what peer support is not. Peer support does not start with the assumption of a problem, nor do we assume that someone needs to be fixed, to be treated, or to be cured. We start with the understanding that everyone could use support at some point in their lives. Peer support is not having a paid friend. This myth really diminishes the value of the role, and it discounts the amount of training and practice and reflection that folks undergo as they prepare for and step into these roles. In Connecticut, recovery support specialists complete 80 hours of core training, pass an exam, and complete additional training and continuing education every year that they maintain their certification. So once they are certified, they are expected to complete 60 hours of continued training every 3 years. Peer support is not about taking care of someone. In peer support, we do not take responsibility for or over anyone. That robs them of their autonomy and challenges the mutuality of the relationship. It can also threaten the foundation of trust. Next slide, please. Peer support is important for so many reasons. It is a source of validation and understanding from someone who gets it. Having that shared lived experience is so important, especially for young people who are dealing with isolation and disconnection, and also who are looking for grown-up versions of themselves, living full and connected lives out in the world. I know as someone who grew up as a queer and trans person, I was constantly looking for grown-up versions of myself who were happy and connected and had support. That's part of what drew me to this work. Peer support improves mental health and recovery outcomes for participants. SAMHSA has a plethora of literature in support of the effectiveness of peer support. Peer support provides participants with relevant and timely resources. This is important because it's a direct reflection of the continuing education that we receive. This education and our connections to other peer supporters throughout the state keeps us informed about resources that may be useful or helpful for the people that we are supporting. And lastly, peer support is offered by folks who are trained and certified here in the state of Connecticut. This education is integral to our ability to offer peer support in authentic ways. Next slide, please. My next slide is, I'm going to read this. This is a testimonial from a young person that I've been supporting for the past 2.5 years or so. So it reads, "My name is Ari and I'm a freshman in college. I have been meeting with Quinn as a participant for the past 2.5 years since I was 17. Throughout this time, Quinn has been there to talk with me about whatever has been going on in my life, and they have supported me through the ups and downs I've experienced. Overall, having Quinn as a mentor and a supporter has been an awesome experience, as they have been there to talk with me and have offered insight and guidance when I needed it. I think every teenager and young adult should have access to someone like that." Next slide, please. There are some barriers, I think, in the world of peer support, and I am not going to present barriers without offering possible solutions because it's not the kind of person that I am. So currently there's a lack of peer support availability to young people in Connecticut, especially those who are not engaged in a state-run or a state-funded program, right? As far as I know, I'm the only peer supporter in the state that young people can come to without having to go through a referral process, without having to be affiliated with any particular program, without having to be a DCF client or a Demas Young Adult Services client. I am available to meet with any young adult in the state, and we need more of that. So I would love to see the expansion of peer support availability to individuals who are under 18 years old. There's currently a lack of awareness of peer support offerings statewide. I think I'm constantly learning about like new offerings and ways to get people plugged in and connected to different things happening through the state. But I think one way that we can combat some of this is to engage the State Department of Education and ask the school systems to share digital versions of peer support flyers so that schools and children and families and students all know what their options are and what the offerings are throughout the state. There's currently no insurance reimbursement for peer support services in the state, and I know that this has been brought up again. There's actually a hearing tomorrow on the Human Services Committee to talk about this very thing. I would urge legislators to please support making peer support services reimbursable by insurance, while maintaining the integrity of the peer support model. And what I mean by that is to ensure that there is clear definitions of what a peer supporter is and what their role is, what peer support is and is not. Ensure that there is an understanding and also like very clear guidance on what that role looks like throughout the state. I think these are steps that we need to take as we're moving towards considering insurance reimbursement. Next slide, please. There's currently little funding for peer support organizations and for projects. I would love to see additional allocation of fundings for peer support projects like the CT support group, like Join Rise B's Young Adult Warm Line, like NAMI Connecticut's offerings for young people, Smart Recovery, et cetera. These are all examples of peer support that's available. And also, I think if we can make it more expansive and more available, it would improve outcomes for so many people. There are currently few employment opportunities for peer support specialists here in Connecticut. I would love to see an increase in the number of peer support specialist roles in state-run and state-funded programs. I think it would be incredible to be able to integrate more of these people who have very valuable lived experience to share with the young people that they're supporting. And there's currently no existing peer support supervision pathway here in Connecticut, leaving peer support specialists to be supervised by clinicians who often fundamentally misunderstand what the role is. I've seen in certain state-run programs where they will hire recovery support specialists and have them report to clinicians who really don't know what to do with them. They're like, I'm not really sure how I'm supposed to integrate you. I'm not really sure, like, you're not clinical, so we're not going to use you on the clinical team. And sometimes these individuals get relegated to things like offering transportation as opposed to being able to do what they were hired to do, which is offer peer support and connect with other people. I would love to see the state develop and implement a supervision model for peer support specialist roles so that we can have people who are new to these roles or stepping into these roles report to someone who has a strong understanding of what that is and what that looks like, and it can also act as a go-between and a liaison between clinical teams and the peer support specialists who are in those programs. Next slide, please. This is how people find out about us. This is how people find us. Most young people find us through our social media. That's just where they are, and that's where it's easy to find us. We have an Instagram page. We also have a TikTok, a YouTube channel, and a Facebook. And then folks also find us through our website sometimes. If we get the search engine optimization just right, we'll pop up. Another way that people find out about us is through community connections. We have community connections with schools and libraries, mental health providers throughout the state, nonprofits, DCF, Demas Young Adult Services, and a lot of these community connections are also folks who are represented on our advisory board, which acts sort of as our guiding, a guiding board of individuals who help us sort of navigate and also get in front of the right people so that they can learn about the services that we're offering, especially this new Discord server. And the last way that people find out about us is through events. A lot of times I will go and speak or table at events throughout the state to really get in front of young people and talk to them about what peer support is, try to dispel some of the myths around it, and also let them know that I am available for them, that I am here to show up for them, to hold space for them, and to ensure that, they're able to get the support that they need. Next slide, please. On this last slide, I've included a handful of resources about, peer support outcomes, cost effectiveness, which I know can be important, how states can implement peer support into the behavioral health continuum. I've also included some information about Medicaid reimbursement from the Office of Legislative Research, and then some overviews of studies of digital peer support and the efficacy and how it's showing promise as a viable way to offer peer support. I thank you all for your time. Thank you.
Thank you, Quinn, and thank you to the other presenters. This has been really, it's a lot of information. And as I'm sitting here listening to everything, and please, you all, I'm sure you have questions, and I'm going to open the floor for a second. But what I saw was that we went from a sort of national into research, into very sort of hyper-local, and then now youth. And I'm just wondering, what you all think and what questions you might have. And if you don't have questions, then I can start, but go for it, Michelle.
Chairwoman, thank you. Good afternoon. Michelle Scott from the Mashantucket Pequot Tribal Nation. So I'm looking at you, Quinn, because come join us. Yes, my questions are for you. So one, I want to acknowledge and appreciate that you came with, these are the barriers, but these are my recommendations. It makes life a lot easier rather than we know that it's an issue. Everyone around the room is here because we recognize that. So I do want to appreciate that. And that, if we had that magic wand of these policy and all of the recommendations, what would be kind of the top, number one?
My number one priority is expanding peer support availability to young people who are under 18. I really think that folks who experience barriers to getting mental health support in clinical settings, whether those are financial, transportation barriers, access to reliable internet or digital devices to be able to access telehealth, insurance barriers, I want these young people to know that there are other options, that there are other ways that they can get support outside of, their parents saying, well, we're on a wait list with this therapist, so we just have to wait for them to call us. I don't want to see that happen. I don't want to see folks just waiting for care, because I don't want people to be, on a fast track towards crisis. I think peer support is really, really good at meeting people where they're at and also sort of changing their trajectory. And I think we don't want to see people without access to that.
I think that's a wonderful answer. And on top of that, what would it what would it take? A dollar amount? I know that you mentioned that you're the only one in the state. How do we get more Quins? How do we get a Quinn in every county? What does like the model for replication look like? What does that cost? You can throw out a figure, but what does that look like for us sitting around this room to kind of propose a dollar amount and human resources to make it happen?
So the project that I work for is currently flat funded at $100,000 a year. And that includes one full-time person who manages the project and also is a peer support specialist offering that peer support. I'm the only one on the project. We also have a part-time staff who manages our social media, who I'm so grateful for. I would love to be able to hire like 3 or 4 more peer support specialists to our staff. What that would look like dollar amount wise, I would like to at least triple our budget to be able to reach more people. And I would like to see more, just in general, more allocation of funding towards peer support services. Currently, I believe that's less than 5% of the state's budget goes towards
Okay.
peer support services. And with the potential introduction of Medicaid reimbursement, you know, we're looking to the state to really protect that existing funding if they are moving towards Medicaid reimbursement. So I would love to see the state sort of reinvest in that. And yeah, in terms of dollar amounts, it's difficult to really put a figure on it.
No, but I appreciate that you had a dollar amount. And then my final question, I know that you said, again, that you're the only Quinn that we have and we want more Quins, but what would that curriculum look like? Is it tailored to provide the training, the necessary certification for youth peer support? And what do you envision with that?
The current training is offered by 2 different organizations. Hartford Healthcare has a Recovery Leadership Academy, and then Advocacy Unlimited also trains recovery support specialists. And they're very similar curriculums. They are not tailored towards youth or young people. I do think that there are ways to incorporate some of that into the existing curriculum. I also think that there are ways to incorporate that into the continuing education offerings. So once people get that, you know, peer support specialist title and they receive their recovery support specialist certification, you know, expanding offerings for people who are interested in working with young people. But currently the state has, like I said, a plethora of people who have this certification who are not currently working in those roles because of the lack of availability of them. So I think like we do have a peer workforce that we can tap into. I would just like to see expansion so that we can tap into that workforce.
All right. Katabatash, thank you.
Thank you.
Appreciate it.
Thank you. When you said there are peer support people in the state, they're not working, is that because of funding?
That is because the lack of availability of roles, and I do think that ties to funding. I think that, you know, when organizations do not receive like specific funding to allocate towards peer support, they don't use other funds to tap into that. Those funds are usually allocated elsewhere.
Thank you. Tammy?
I'm Tammy Venegay. I work for the Department of Developmental Services. I'm just wondering if there's any youth support for individuals with intellectual disabilities. For our youth, oftentimes, as soon as somebody finds out they have an intellectual disability, their behavioral health or their mental health is totally ignored because of one diagnosis. And they need support from like people or somebody who's willing to listen to them as well. Is that something that's available in Connecticut? Because I haven't been able to find it yet. I'm looking for it for our youth that are with our department. But do you know if something like that exists or how someone in our department could get hooked up with peer support?
That may be a better question for Favor, honestly. I think they may have better ideas about, you know, potential offerings. But I do know that like I do have experience working with folks who have developmental disabilities. You know, that's something that I think most recovery support specialists would be comfortable with. And again, I think we can tap into those continuing education credits and get people trained in understanding of, you know, some of the challenges, unique challenges that folks may be encountering.
Thank you. Jeff?
Thank you for the presentation. So Elise, who presented earlier, works for me at CHDI, and we're doing that landscape study. I hope that we're talking to you already. If we're not, expect a phone call or an email from us soon.
Give me a call.
So my questions are really for you, but also for Favor if they're still on the line. I noticed that there was a couple of different ways of approaching it. One model was having family or peer or youth peer support specialists embedded within particular clinical programs. It sounds like you're somebody who is not embedded.
Correct.
Versus having more of a standalone family and youth peer support approach where those individuals can really work across programs regardless of where they happen to refer to. Do you have a preference or a recommended approach that you think would work best in the system?
I think just after hearing from some folks talk about wait lists in terms of accessing peer support, I would prefer to see more standalone projects like the CT support group. And the reason that I say that is really centered in wanting to remove as many barriers as possible. I think enrollment in programs and clinical programs comes with a lot of paperwork, eligibility requirements, and I would like to see folks be able to access peer support without having to go through that process and without having to be subjected to sometimes like really personal and invasive questions. I think removing those barriers and being able to create that foundation of trust and build that mutually without the participants sort of coming in and already feeling exposed, like you have all this information about me already and I feel vulnerable. So removing some of those barriers, removing insurance barriers, cost barriers, transportation barriers, I think the standalone projects could really address a lot of that.
Thank you. I don't know if Favor is still on or is able to respond.
Yes. Yes, thanks, Jeff. We also agree with Gwen. The standalone, such as ours, it is very important. We don't have, a lot of the barriers that I would assume that other, providers have. So the standalone projects are essential. However, I would just ask that not to see that as a barrier to access us, still call us into those kind of clinical settings for families when needed. I know that Millie explained that in her presentation as well, but peer support can, be essential anywhere. So knowing that we're here and knowing that we're willing to partner, is also important for providers to know.
Great, thank you. And Quinn, apparently I hear from Elise, you are involved with us and that you will be, have agreed to share the youth survey that Elise is planning through our study on the Discord server. So thank you for that collaboration and the information you're bringing, feeding into that report so that we can have a coordinated statewide approach to family and youth peer support is going to be really critical. Thank you.
Absolutely.
Thank you. I have a couple of questions. One in particular is, I know that you're using the Discord server and that you stated that people are finding you through social media and also through the website, and that you are housed inside of Positive Directions
Correct.
as the overarching funding.
Alligator.
Thank
Yeah.
you. Yes. And so I'm just curious, where does the Connecticut support group come in? I'm just trying to understand the logic of the
Yeah,
hierarchy.
absolutely. So the Connecticut Support Group is the name of our project, right? And we have our website, Discord server, and peer support offerings. And so that is housed under Positive Directions because the director of our project, Margaret Watt, is our prevention director there and has been overseeing the project since its inception 10 years ago. But we are solely funded by the Department of Mental Health and Addiction Services Young Adult Services Division. So that is where our funding comes from.
So and how many would you say you're not case load, but would you the people you're working with peer support, how many would you say roughly you're working with? How many people?
It really depends. Last year, I supported 13 individual young people. Most of those were multiple meetings that sort of happen as needed. The nice thing about peer support is it can be really on demand. You don't have to go out of your way to schedule an appointment. So long as I have free time, I will set up a Zoom call. I meet up with people in the community at coffee shops, libraries, community centers, things like that. So yeah, last year we had 13. And we're hoping to grow that, especially with the Discord server offering. So right now we launched it last month. We have 40 members of the Discord, and we're really hoping to continue to grow that.
Thank you. And are you seeing any increase because of current fears about federal legislation?
I am, yes, from young people who either are immigrants or have family members who are immigrants. I'm also seeing a lot of queer and trans young people in a very fearful state and really looking for support and looking for support from someone who also understands that and who looks like them. But yeah, that is something that I have noticed. I also noticed that, in the adult sphere that I work in outside of my full-time job. So this is something that is really going on everywhere.
Okay, thank you. Christina.
Thank you, and thank you for your presentation, Quinn. I'm wondering whether you receive referrals from or have youth who are involved with DCF or in the care of DCF, whether you're able to connect with those youth, and whether that's been explored as an option for expansion.
Yes. So it's okay. So I have supported young people who are DCF involved. We do have a DCF staff member who is on our advisory board who is helping us sort of get a little bit more integrated into the DCF system and a little bit more knowledgeable of the sort of where the gaps are and where folks can use support. One of the other outside avenues that I've used to connect with young people who are DCF involved is through the New Haven Pride Center, who has a peer mentorship program, which I think has been really effective and really integral. So, those are sort of my two avenues into DCF. But yes, I have supported DCF involved young people. And yes, we were looking into how can we continue to do that? How can we get in front of, my goal is to sort of get in front of the DCF youth advisory boards. I think that's really sort of where we're going to get our foot in the door and also find young people who are willing to talk to their peers and spread the word about this is a thing that's available. Join their Discord, jump on Monday night at 7 and Quinn's going to be there to hang out and talk to people.
Any other questions in the room? Not just for Quinn, although Quinn, seriously, we appreciate you.
Of course.
Yes, Nicole.
Thank you. I just wanted to add my appreciation to all the presenters today, and especially our ongoing collaboration with Favor and CHDI. And I know that Stephanie does sit on your board, and I do look forward to our future collaboration. Thank you.
Yeah.
Thank you. Okay, I think you're off the hot seat, Quinn. So just to reiterate what Dr. Taylor said, yes, we do appreciate all the presenters today. It was an interesting view into the ecosystem on peer support, and I look forward to the study from CHDI. I think that that's really helpful. And coming back again to Jamie. Jamie, thank you for setting the space for us in terms of peer support. We really appreciated you taking the time today. Turning back.
All right. Yes, and thank you to all of our presenters. Just so that you know, we've worked together for the past month. I am preparing for the presentation, and so I do appreciate all the time that they took to meet with us on multiple times to be prepared today. Couple other things that I want to close this out, and then we are done. The TCB currently, as you notice, we've had an influx of scheduling, different changing our monthly schedule due to various, whether it be holidays or whether it be the legislative sessions and so forth, meetings. And so we predict that there will be a few more changes coming up. So the April session, March, we are scheduled for March, currently March 26th. Is that correct? March 26th. And then for April, we are looking at April 16th. May will be May 14th. And then June 18th. We won't get back on schedule until July. And that would mean that we would go back to meeting the first Wednesday of the month. We will be sending all this out in an email, but please continue to be flexible with us as we are in the midst of session, and so things happen, and we're very mindful of the schedule. So we are paying attention to the schedule and communicating with you all when changes are happening. But wanted to give you that update in regards to the March meeting. It will be March 26th and then April 16th, and we'll move forward with sending you an email with all the revised dates. And then lastly, just another advertisement to please schedule, reach out to us if you want to be part of any of the work groups. We are looking to refresh those work group memberships again. This month, we are meeting with all the co-chairs in establishing the work plan for 2025. And then hopefully to activate the work groups again in April. One last thing I just remembered, you all will be getting soon a draft of our TCB strategic plan. It is very much a draft. We are, looking for input, and this, if you remember, during the summer, we spent a lot of time together, full days together, luncheons together, identifying priorities, identifying the goals, the mission statement, the purpose, and so forth. So we have collected and gathered all of that information, typed it up, have met with leadership and work groups and so forth, and we will continue to do so. But we expect to have a first draft of the TCB 3-year strategic plan for the TCB March 26 meeting. So stay tuned. You will be receiving a draft. Okay, and that is it.
Hey, thank you all so much for being here. Appreciate you.
Thank you.